Good morning, everybody, and I am grateful to be joined here today with so many women to talk about our important work together to protect access to contraception, known as the PAC Act. I think today this piece of legislation is going to be introduced across this country and across Minnesota. Women now have access to no-cost birth control, no cost to a necessary medication, no cost to access to something that is important to women, young and old, across the state of Minnesota. President Obama, when passing the Affordable Care Act, made sure that women had access to birth control, to contraception, to the contraception of their choice, without any additional cost. And the legislation that we are introducing embeds that policy here in the state of Minnesota. The Trump administration is busy working to repeal and roll back this protection for women, and in Minnesota that could impact as many as 1 million women. It is important that people have access to the contraception of their choice without any additional cost. We know, and I know as a nurse, that access to the contraception of your choice prevents unwanted pregnancy. It gives women the ability to choose when they're going to have their children. And most importantly to me, it assures that we have the ability to guide our own lives, to make the decision about when we are going to start our family, when we will have our children. And for me, this is an issue of health. It is an issue of access and choice. It is an issue of justice, but most importantly, it is an issue of economic security. For women to have their full participation in society, in our open democracy, and in the workplace, we have to have control over this very important part of our lives. And access to no-cost contraception, the contraception of our choice, assures that for us. And that is why this piece of legislation is so important for Minnesota. And that is why I'm joined today with so many of my colleagues to support it. And with that, I'd like to introduce Senator Sandy Pappas.
Thank you, Representative Murphy. As a 19-year-old student without health insurance, that is where I turned to for my first birth control was Planned Parenthood. So I feel like I've been part of the family for a long time here. I'm very proud to be the chief author of this bill and play a part in ensuring that health plans include no-cost contraception and continue to include no-cost contraception in Minnesota. While I'm proud to carry it, the dire need for this bill is both sad and troubling. Why, in 2018, do we need to fight for and protect women's health issues? Do we not all agree that it's critical that a woman decide if and when they get pregnant? Do we not all agree that patient education regarding family planning is a positive thing for our society? And do we not all agree that all women, regardless of income and background, deserve control over their reproductive decisions? We all benefit from women having control over their bodies and reproductive choices. And we know that 99% of women use birth control at some point during their reproductive years. While I'm proud to be a strong advocate for reproductive rights and choices, I will be even more proud when one day it is not something that we have to fight for, that we just assume that we get. Thank you. And next, I'd like to introduce Representative Hortman.
I'm so proud to stand here with Representative Murphy and Senator Pappas. No one has fought harder in the Minnesota legislature for reproductive rights than these two champions. You know, as my daughter Sophie was looking to head off to college and we were looking at the different states that she was considering, we were looking at state laws and we were looking at who were the governors and who were the legislatures and what might the laws be in the future, because it was so important to me that my daughter have access to birth control at college. You know, healthcare decisions should be made by women and their doctors, and we should have state policy that enables those choices to be made by the people whose lives are most affected by them. So I'm happy to support Representative Murphy and Senator Pappas's legislation, and then I'm going to hand it off to Sarah Stace.
Hi, thank you. Hello, good morning. I'm Sarah Stace. I'm the president and CEO of Planned Parenthood, Minnesota, North Dakota, South Dakota. I'm here today on behalf of our Action Fund. And first, I would like to thank these incredible legislative leaders for their work on this important issue. This is obviously a conversation that should not be necessary in 2018. We should be decades beyond fighting for basic birth control, but since President Trump took office, We have seen real threats to keep women from using birth control escalating across our country, and now it is up to the states to protect access to this fundamental health care benefit. We are so fortunate in Minnesota to have legislative leaders like those who are with us today who are standing up to protect access to the most basic health care so that women can lead healthy and productive lives. Everyone knows that women and families do better when we can use birth control to plan our families. It's just a very simple thing. It's not complicated. Women and babies are healthier when women are empowered to plan and space their births, and I use the word empowered deliberately because 1/3 of the wage gains women have made since the 1960s are because of birth control. And 6 times more women complete college today than they did before we had access to birth control. This isn't just a healthcare issue, it's an equality issue, and it's an economic issue. Prior to the Affordable Care Act, contraceptives made up 30 to 40% of women's total out-of-pocket health care spending every year, and that meant that more than half of the young women in this country struggled to consistently afford their birth control. We also know that every dollar spent on family planning saves more than $7 in public funds. The PAC Act is simply common sense legislation. It's also critical to remember that many women use birth control to manage serious medical issues. And for women like these, birth control isn't just about family planning. It's a matter of health and quality of life. And I am honored now to introduce you to one of these women, Sarah Barrett.
Hello. My name is Sarah Barrett, and I am one of the 5 million women in America who lives with polycystic ovarian syndrome. Getting diagnosed with PCOS meant learning that I was at a much higher risk of heart attack, diabetes, and endometrial cancer. I might never be able to get pregnant was also one of the side effects. There's no cure for PCOS, but hormonal birth control can manage the symptoms and reduce the risk of serious health issues. If it weren't for Planned Parenthood, I wouldn't have been able to manage my PCOS. These matters should stay between me and my doctor, and they should never be up for debate by my boss or the president. Now, because I have access to birth control, I feel healthy and capable of reaching my goals. I'm also the grateful and proud mother of an incredible little girl, and the thought that she could grow up in a world where she might not be able to get the medication she needs because of stereotypes and preconceived notions about what that medication does is really terrifying. I can only hope that she won't have to fight for the right to this basic part of healthcare, and we can make sure that she doesn't. Having access to birth control has changed my life. It could change my daughter's life. I happen to have a medical need for birth control, and I'm one of the many, many women who do. But the fact is, it doesn't matter the reason that someone uses birth control. This is basic health care, and that's why I'm here today. Thank you.
Anyone have any questions?
Representative Murphy, explain the mechanics to me of how this would work in state statute and state law. How is there free access? Is there a cost to the state in this?
This is current law federally. And right now, if a health plan offers prescription drug coverage, we say that they also have to cover FDA-approved contraception. That is the current law. It became the law under the Affordable Care Act, and we want to make sure it remains law here in the state of Minnesota. And so, from my perspective, when we are making birth control accessible and affordable to women, not only does it save women and their families dollars, but it is also a way that we save dollars in our healthcare budgets across the state of Minnesota. So it is not an expense, but in fact a savings for the state of Minnesota. But more importantly, it is a very important provision of healthcare for women across the state of Minnesota. And the efforts by the Trump administration to repeal or weaken the law means that more than 1 million women could be incurring additional costs or not have access to the medication that they need when they need it.
So if I hear you correctly, basically what you're saying is the state of Minnesota needs to adopt this federal rule under the Affordable Care Act so that if it's repealed on the federal level, it's in force on the state level for all health policies sold in the state of Minnesota. I see a lot of nodding heads.
That's correct. That's correct. And so with the choir, I will say that that is right, and this is something that we have been working on since 2015 here in Minnesota. And it's important that Minnesota law reflects this. It's common sense. It supports women and families across the state of Minnesota, and it provides access to a very reliable kind of medication that people rely on all over for many, many reasons here in the state of Minnesota.
How does this interface with the? Is this the rule that Trump went to court on the employer rule, and now that's tied up in the courts, and where does it stand? If that's the one that you're saying, where does it stand now? And is it still being appealed?
As far as I know, it is still in the courts.
And that's the rule that you're talking about, that would include for employers moral objectives and not just religious objections.
That's right, and this legislation reflects the determination by the Supreme Court and gives religiously oriented employers the option to defer to insurance companies to provide that coverage.
So that would be maintained in the state law that you're, in the proposed state law?
Yes.
Okay, and do you have any problems with that fundamentally? I understand that the environment is such that maybe you need to do it, but do you have a problem with that, with some employers not having the option to not offer it?
So we have a provision in this that says if an employer is choosing for religious reasons, if they are a religiously oriented employer and they choose for religious reasons to not provide birth control, that the health insurance company that they're contracting with must provide that coverage for the women that are covered by those policies. So for the women who are seeking birth control at no cost, that coverage is intact for them.
And this is 1 million Minnesotans? 1 million Minnesotans?
Yes.
That's a lot.
Yes.
I just wanted to add that in terms of cost, you have to recognize that it's much cheaper for the insurance company to provide contraception than to pay for a birth.
Have you found that there's an opposition to conception here, not conception, but birth control here at the Capitol? Do people oppose that for moral or religious reasons? Have you found a pushback on that?
What I have found in the last 3 years that I've been working on this piece of legislation is a real resistance to take the issue up in the Republican-led legislature, which is confusing to me because contraception is basic health care for women. It is used to treat many conditions, including our ability to determine when we're going to have our families. It seems to me to be a place of strong consensus around values for people who support healthy childbirth. For those who may be opposed to abortion, preventing unwanted pregnancies is a proven tool to reduce abortion. And so for me, I continue to be confused by the Republican recalcitrance to this issue. And I would ask Minnesotans across the state who support this idea and to support this public policy to make their voices heard across the state of Minnesota. I think it is important to ask the question, why are you resisting putting this common sense policy into place and to protect access for women and families to something as necessary as no-cost birth control?
I just want to add something realistically, that since we know that 99% of women do use birth control at some point during their reproductive years, the hypocrisy out there that if there are Republican families that do not have 10 children, then chances are that, sometimes people can't have children, obviously, but chances are they have been using birth control.